Introduction. Earache is a condition commonly seen in children, but can also affect adults. The pain may be dull, sharp, or burning, and usually involves only one ear. It may be accompanied by fever or partial hearing loss. Earaches can have multiple causes and usually clear on their own. If symptoms are severe or persistent, you should see a doctor for evaluation. Causes. Earaches can be caused due to an irritation, infection, or injury. Infection can occur in the outer, middle, or inner ear. Outer ear infections usually occur due to scratching or introducing an object into the ear canal. Water that enters the ear canal can soften the skin and encourage an infection. Fluid may build up in the middle ear due to a respiratory tract infection and lead to an ear infection. Respiratory tract infections can also affect the inner ear. Other causes of earaches include changes in pressure while flying in an airplane, loud noises, a foreign object lodged inside the ear, buildup of earwax, a perforated eardrum, and sinus infection. Earaches may sometimes be from pain that is referred from another region, such as the jaw and teeth. Signs and symptoms. Earaches may be accompanied by impaired hearing and drainage of fluid or blood from the ear. The pain may be short-lived, intermittent, or ongoing. Fever and mild hearing loss may accompany ear pain. Young children with earaches are usually irritable, fussy, and may pull at the affected ear. They may experience headaches, inability to sleep, and decreased appetite. They may not respond easily to sounds and can have issues with balance. Diagnosis. You should see a doctor if earache is severe or persistent and accompanied by fever, dizziness, headache, swelling around the ear, blood or pus drainage, or facial muscle drooping. Your doctor will review your symptoms and perform a physical examination. An instrument called an otoscope is inserted into the ear canal to evaluate the outer canal and eardrum. Your doctor will look for signs of respiratory tract or sinus infection. A hearing test may also be recommended. Drainage from the ear may be obtained and sent to be evaluated in a laboratory. Rarely, imaging tests such as an X-ray or CT scan may be necessary to evaluate structural problems or identify for the presence of tumors. Treatment. To prevent earaches, you should keep foreign objects out of the ear. Dry your ears thoroughly after a bath or swim. Avoid smoking or secondhand smoke, and avoid allergy triggers such as dust and pollen. To treat an earache at home, you could place a cold pack over a towel on the ear for 20 minutes to decrease pain. Pressure can be relieved by chewing gum or swallowing. Sitting upright helps relieve middle ear pressure. Over-the-counter pain relievers and ear drops may also help the discomfort. Breast or bottle feeding can relieve ear pain in young children. To treat an ear infection, your doctor may prescribe ear drops or oral antibiotics. Other infections causing ear pain are identified and treated directly. A foreign object may be removed from the ear using special instruments. Wax softening ear drops and an ear lavage may be recommended to remove excess wax. Summary. Earaches are quite common in children and can typically be easily treated. They are usually the result of an infection, but can have various causes. Consult a doctor if the earache is severe or accompanied by other symptoms.